Who this patient walked into the ER, thinking it was nothing. Minutes later, their life was in danger. Watch till the end. These ER visits will shock you. Emergency rooms see things most people can't even imagine. In this video, a doctor reacts to some of the most shocking, unbelievable, and eye-opening ER visits, breaking down what really happens behind hospital doors. From life-threatening injuries and sudden collapses to bizarre symptoms and medical mistakes, this reaction video explains what actually goes wrong in these ER cases, how doctors think in high-pressure emergency situations, common myths versus real emergency medicine, which ER visits could have been prevented, warning signs you should never ignore. This video is made to educate, not scare. Understanding these shocking ER cases can help you make smarter health decisions and know when to seek emergency care. Whether you're interested in real medical stories, health education, or doctor reactions, this video will keep you watching till the end. Emergency rooms are places where every second matters, and the situations doctors face can be shocking, emotional, and sometimes completely unexpected. In this video, a doctor reacts to some of the most shocking ER visits, explaining what really happens when patients arrive at the emergency room with serious, strange, or life-threatening conditions. Many people think they understand emergencies, but the reality inside an ER is very different from what we see on TV or social media. This video takes you behind the scenes of emergency medicine through real reactions and professional medical insight. From patients who ignored warning signs for too long to sudden medical collapses that came out of nowhere, these ER visits show how fast a normal day can turn into a medical crisis. The doctor reacts by breaking down symptoms, explaining what likely went wrong inside the body, and discussing how emergency teams respond under extreme pressure. These reactions are not meant to scare you, but to educate and raise awareness about health situations that should never be ignored. Many shocking ER visits happen because people underestimate their symptoms. Chest pain, shortness of breath, severe headaches, confusion, fainting, uncontrolled bleeding, or sudden weakness are often brushed off as nothing serious. In reality, these signs can point to heart attacks, strokes, internal bleeding, infections, or other dangerous conditions. In this video, the doctor explains why early action can save lives and how delays can make situations much worse. Some ER cases are shocking, not just because of their severity, but because they were preventable. Poor lifestyle choices, ignoring medical advice, misuse of medications, and lack of basic health awareness often lead patients to the emergency room. Through these reactions, the doctor explains what could have been done differently and how viewers can protect themselves and their families by making better health decisions. Emergency rooms also see many unexpected and unusual cases. Foreign objects, extreme injuries, rare reactions, and bizarre symptoms are more common than people think. In this video, the doctor reacts calmly and professionally, explaining the medical logic behind these cases and how her staff are trained to handle even the most unbelievable situation. No matter how shocking the case, emergency teams must stay focused, fast, and precise. This video also highlights the mental and emotional pressure doctors and nurses face every day. Making life or death decisions, dealing with pain and fear, and managing multiple emergencies at once is not easy. Through these reactions, viewers gain respect for medical professionals and a deeper understanding of how demanding emergency medicine really is. Another important part of this video is learning when an ER visit is truly necessary. Many people either go too late or go for the wrong reason. The doctor explains the difference between urgent emergency and non-emergency symptoms, so viewers can make smarter decisions. Knowing when to seek immediate care can save lives and reduce unnecessary strain on emergency departments. These shocking air visits also show how fast conditions can change. A patient who looks stable can suddenly crash, while someone who appears critical can recover with quick treatment. This unpredictability is why emergency medicine requires constant attention and teamwork. The doctor's reactions help viewers understand how doctors think in these moments and what signs they watch for closely. Health education is one of the main goals of this video. By reacting to real-air scenarios, the doctor turns shocking moments into learning opportunities. Viewers will understand common medical myths, recognize dangerous symptoms, and feel more confident about seeking help when needed. This knowledge can make a real difference in everyday life. Whether you are interested in medical stories, doctor reactions, emergency medicine, or health awareness, this video offers valuable insight. It is informative, engaging, and designed to keep you watching until the end. Every reaction is based on medical experience, not guesswork, making this content both trustworthy and educational. If you or someone you love has ever visited the emergency room, this video may feel familiar. If you have never experienced an air visit, this video may help prepare you for situations you hope never happen. Understanding emergencies before they occur can reduce fear and improve outcomes. If you enjoyed this video and learned something new, make sure to subscribe to the channel for more doctor reactions, real medical explanations, and health awareness content. New videos are uploaded regularly to help you stay informed and make better health decisions. Like the video, share it with others, and comment below to let us know which air visit shocked you the most and what topics you want to see next. Emergency rooms are some of the most intense and unpredictable places in the world. Every day, doctors and nurses face situations that can change within seconds, and many of the cases they see are shocking, emotional, and sometimes difficult to believe. In this video, a doctor reacts to shocking ear visits, offering professional medical insight into what really happens when patients arrive at the emergency room in critical condition. These reactions are based on real medical knowledge and experience, giving viewers a deeper understanding of emergency medicine and the reality behind hospital doors. Many people only see emergency rooms through movies or short online clips, but the truth is far more complex. Patients come to the ER for many reasons, ranging from minor concerns to life-threatening emergencies. In this video, the doctor reacts to cases that stand out because of how serious, unexpected, or preventable they were. Each reaction explains what likely happened inside the body, why the situation became dangerous, and how emergency teams respond when time is limited. One of the most shocking parts of air medicine is how often people ignore early warning signs. Symptoms like chest pain, difficulty breathing, sudden weakness, severe headaches, dizziness, confusion, or uncontrolled bleeding are sometimes brushed off as stress, fatigue, or minor problems. By the time patients reach the ER, their condition may have worsened significantly. In this video, the doctor explains why listening to your body is so important and how early medical attention can prevent serious outcomes. Many air visits become shocking because they were avoidable. Poor lifestyle habits, ignoring doctor advice, misuse of medications, substance abuse, and lack of basic health awareness are common reasons patients end up in emergency rooms. Through these reactions, the doctor explains what could have been done differently and how simple changes can reduce the risk of emergency. The goal is not to judge, but to educate and help viewers make safer choices in their own lives. Emergency rooms also deal with sudden and unexpected medical crises. Heart attacks, strokes, severe infections, allergic reactions, diabetic emergencies, and traumatic injuries can happen without warning. In these moments, emergency teams must act fast and work together. This video shows how doctors think under pressure, how they prioritize patients, and how critical decisions are made in seconds. The reactions help viewers understand why our staff may appear calm, even in chaotic situations. Some visits are shocking because of how unusual they are. Doctors often see cases involving foreign objects, rare conditions, extreme injuries, or symptoms that don't immediately make sense. In this video, the doctor reacts to such cases and explains the medical reasoning behind diagnosis and treatment. These explanations help viewers understand that emergency medicine is not just about speed, but also about careful observation and problem solving. Another important part of this video is understanding the emotional and mental strain of emergency medicine. Doctors and nurses regularly face pain, fear, loss, and high-stress situations. Making life or death decisions while managing multiple patients is incredibly demanding. Through these reactions, viewers gain respect for medical professionals and insight into the challenges they face every day. Emergency medicine requires not only medical skill, but also emotional strength and teamwork. The video also helps viewers learn when an AE visit is truly necessary. Many people either wait too long to seek help or go to the emergency room for non-urgent issues. The doctor explains the difference between emergencies that need immediate care and conditions that can be managed elsewhere. This knowledge can help viewers make better decisions and reduce unnecessary pressure on emergency departments. Another shocking reality of ER visits is how quickly a patient's condition can change. Someone who appears stable can suddenly deteriorate, while a patient in critical condition may improve with fast treatment. This unpredictability is why emergency rooms must always be prepared for the worst. The doctor's reactions explain what warning signs medical teams watch closely and how rapid intervention can save lives. This video is also about breaking medical myths. Many people believe false information about symptoms, treatments, and emergencies. Through real reactions, the doctor clears up misunderstandings and explains what actually matters in emergency situations. This kind of education can reduce fear and help people respond more confidently during medical crises. The reactions in this video are not meant to shock for entertainment alone. Each case is used as a teaching moment, helping viewers understand the importance of health awareness and prevention. Knowing the signs of serious conditions, understanding basic first aid principles, and recognizing when to seek help can make a huge difference. This video turns shocking ER visits into valuable lessons that can be applied in everyday life. Whether you are interested in medical stories, doctor reaction videos, or learning more about how the human body responds to emergencies, this content offers something valuable. It combines real medical knowledge with engaging reactions, making complex topics easier to understand. The explanations are designed for a general audience, so you don't need a medical background to learn from this video. For viewers who have experienced an emergency room visit, this video may feel familiar and relatable. For those who have never been to the ER, it offers insight into what could happen and how to prepare mentally. Understanding emergencies before they happen can reduce panic and lead to better outcomes if a crisis ever occurs. Health education is a key focus of this channel, and this video is part of that mission. By reacting to shocking air visits, the doctor helps spread awareness about common health risks, dangerous symptoms, and the importance of timely medical care. Small decisions like not ignoring symptoms or following medical advice can have life-saving effects. This video also highlights the importance of trust between patients and medical professionals. Clear communication, honesty about symptoms, and following treatment plans are essential in emergency care. The doctor's reactions explain how missing information or delayed action can complicate treatment and increase risk. As you watch this video, you may find yourself thinking differently about your own health. That is the purpose of this content. Awareness leads to prevention, and prevention saves lives. The more people understand about emergencies, the better prepared they are to handle them. If you enjoy this video and find it helpful, make sure to subscribe to the channel for more doctor reactions, medical explanations, and health awareness content. New videos are created to educate, inform, and help viewers make better health decisions. Liking the video, sharing it with others, and leaving a comment helps support the channel and spread important information. Your support allows this channel to continue creating educational medical content reaches more people. If even one viewer learns something that helps them avoid a medical emergency or act faster during a crisis, this video has achieved its goal. Watch till the end, stay informed, and take care of your health. Emergency rooms are places where reality is raw, fast, and unforgiving. Every day, doctors walk into situations where a single decision can change the course of a person's life. In this video, a doctor reacts to shocking air visits and explains what truly happens when patients arrive in emergency care under critical, confusing, or terrifying circumstances. These reactions are not exaggerated stories or dramatic television scenes, but reflections of real medical situations that doctors face regularly. Many people believe that emergency rooms are only for major accidents, but the truth is far more complex. Patients come in with symptoms they ignored, pain they underestimated, or conditions that escalated without warning. In this video, the doctor reacts to these air visits and explains how small symptoms can quickly turn into life-threatening emergencies. Viewers will begin to understand how fragile health can be and why early medical attention is so important. A common theme in shocking air visits is delay. People often wait too long before seeking help. They hope pain will go away, blame stress or fatigue, or fear hospitals. Chest discomfort, shortness of breath, numbness, confusion, high fever, severe abdominal pain, and sudden weakness are frequently dismissed. By the time patients arrive at the ER, their condition may already be critical. Through these reactions, the doctor explains how earlier action could have changed outcomes. Another reason air visits become shocking is lack of health awareness. Many patients do not understand how their bodies work or how certain habits affect long-term health. Poor diet, lack of exercise, smoking, alcohol misuse, and ignoring chronic conditions slowly push the body toward crisis. The doctor reacts to these cases by explaining what went wrong internally and how these emergencies often build silently over time. Summer visits are shocking because they are completely unexpected. Healthy-appearing individuals can suddenly collapse due to heart rhythm problems, blood clots, severe infections, or allergic reactions. These cases remind viewers that medical emergencies do not always give warning. In this video, the doctor explains how emergency teams assess patients quickly, identify the most dangerous problems first, and act under intense pressure. Emergency rooms also see a wide range of injury. Car accidents, falls, workplace incidents, sports injuries, and household accidents can cause severe trauma. The doctor reacts to such cases and explains how trauma care works, why certain injuries are more dangerous than they appear, and how internal damage is sometimes hidden. These explanations help viewers understand why our doctors often order urgent tests, even when injuries look minor on the surface. Some shocking ear visits happen because of medication misuse. Taking the wrong dose, mixing medications, ignoring prescriptions, or using unverified supplements can cause serious harm. In this video, the doctor reacts to these situations and explains how medications affect the body and why misuse can lead to emergency. This serves as an important reminder that medications should always be taken responsibly and under medical guidance. Emergency rooms also handle mental health crises. Panic attacks, severe anxiety, suicidal thoughts, and emotional breakdowns bring many patients to the ER. These visits can be shocking not because of visible injuries, but because of the intensity of psychological distress. The doctor reacts with care and explains how mental health is deeply connected to physical health and why these emergencies must be taken seriously. Another shocking reality of medicine is unpredictability. A patient who seems stable can suddenly deteriorate, while someone who arrives critically ill can improve rapidly with treatment. The doctor explains how emergency teams constantly reassess patients and adjust treatment plans. This constant vigilance is what makes emergency medicine so demanding and mentally exhausting. The video also sheds light on the emotional toll emergency medicine takes on healthcare workers. Doctors and nurses witness pain, fear, and loss on a daily basis. They must stay calm while delivering bad news, making rapid decisions, and handling multiple emergencies at once. Through these reactions, viewers gain a deeper appreciation for the resilience and dedication required to work in an ER. Many shocking ER visits are preventable. Conditions like uncontrolled diabetes, high blood pressure, infections, and dehydration often become emergencies because they were neglected. The doctor reacts to these cases by explaining how regular checkups, medication adherence, and healthy habits could reduce emergency risks. Prevention is a powerful theme throughout the video. Another important lesson in this video is understanding when to go to the ER. Some people avoid emergency care until it is too late, while others rush to the ER for minor issues. The doctor explains the difference between urgent symptoms and non-emergency problems, helping viewers make better decisions in the future. Knowing when to seek immediate help can save lives. The reactions in this video also address medical myths. Many people believe incorrect information about pain, symptoms, and treatment. The doctor corrects these misunderstandings using real examples, helping viewers separate fact from fiction. Accurate information can reduce fear and help people act appropriately during emergency. Emergency rooms are also places where teamwork is essential. Doctors, nurses, paramedics, technicians, and support staff must work together seamlessly. The doctor explains how communication and coordination are critical during emergencies. A delay or misunderstanding can have serious consequences, which is why teamwork is emphasized in every ride. For viewers, this video is both educational and eye-opening. It shows how quickly life can change and how important it is to respect health warning signs. Watching a doctor react to shocking ER visits helps people understand the seriousness of emergencies without needing to experience them firsthand. This content is not meant to frighten viewers, but to empower them. Knowledge reduces panic. When people understand what symptoms mean and how emergencies are handled, they are more likely to seek help at the right time. The doctor's calm explanations help viewers feel informed rather than overwhelmed. Many people who watch this video may recognize situations similar to their own experiences or those of loved ones. These moments can be emotional, but they also provide learning opportunities. Every reaction in this video is meant to encourage awareness, responsibility, and better health decisions. The video also highlights how important honesty is in emergency care. Patients who clearly describe symptoms, timelines, and medical history help doctors provide faster and safer treatment. The doctor reacts to cases where missing information made treatment more difficult and explains why communication matters. As the video progresses, viewers begin to see patterns. Ignored symptoms, delayed care, poor habits, and misinformation repeatedly lead to emergencies. The doctor's reactions connect these patterns and help viewers understand how to break the cycle before it leads to an ER visit. Emergency medicine is not just about saving lives in dramatic moments. It is about preparation, prevention, and quick thinking. This video captures all of that through real reactions and explanations that are easy to understand. If you are interested in real medical stories, doctor reaction videos, or learning how the human body responds under stress, this video offers valuable insight. It is designed to keep you engaged while also teaching important health lessons that can apply to anyone. Watching this video may change how you think about your own health. You may notice symptoms more carefully, take medical advice more seriously, or feel more confident about seeking help. That awareness is the true goal of this content. If you found this video helpful or informative, subscribing to the channel helps you stay connected with more medical reactions and health education content. New videos are created to help viewers understand their bodies, recognize danger signs, and make smarter health choices. Liking the video and sharing it with others helps spread important information. Someone else may learn something that protects their health or even saves a life. Commenting also helps build a community where people can learn and share experiences together. Emergency rooms will always be places of urgency and intensity, but education can reduce fear and improve outcomes. This video is one step toward better understanding emergencies before they happen. Stay informed, stay aware, and take care of your health. Emergency rooms are places where life changes without warning. One moment everything feels normal, and the next moment someone is fighting for their life. In this video, a doctor reacts to shocking ER visits and explains what truly happens when patients arrive at the emergency room in serious or unexpected conditions. These reactions are based on real medical thinking and real emergency situations, giving viewers an honest look into how emergency medicine works. Many people think emergency rooms are only for accidents or visible injuries, but doctors know that some of the most dangerous emergencies are invisible. Chest discomfort, trouble breathing, confusion, sudden weakness, severe headaches, or unexplained pain may not look dramatic, but they can signal life-threatening conditions. In this video, the doctor reacts to ER visits where early symptoms were ignored and explains how those small warning signs became major emergencies. One of the most shocking patterns in ER visits is delay. People often wait too long to seek medical help. Fear, denial, lack of knowledge, or hoping the problem will resolve on its own causes many patients to arrive at the ER when their condition has already worsened. Through calm and professional reactions, the doctor explains why timing is critical in emergency medicine and how minutes can make the difference between recovery and serious complications. Many emergency room cases are shocking because they were preventable. Chronic conditions such as high blood pressure, diabetes, asthma, and heart disease often turn into emergencies when not managed properly. In this video, the doctor reacts to cases where missed medications, poor lifestyle choices, or lack of follow-up care led to serious consequences. These reactions are meant to educate viewers, not blame them, and to show how prevention plays a major role in health. Some air visits are shocking simply because they happen so suddenly. A person may appear healthy and active, then suddenly collapse due to a heart rhythm problem, blood clot, stroke, or severe infection. The doctor explains how emergency teams assess these patients quickly, identify the most urgent threats, and begin treatment immediately. These reactions show how unpredictable the human body can be and why emergency departments must always be prepared. Emergency rooms also see a wide range of injuries that vary in severity. Falls, road accidents, workplace incidents, sports injuries, and home accidents bring patients into the ER every day. Some injuries look minor, but hide internal damage, while others appear severe but are less dangerous. The doctor reacts to these cases and explains how doctors determine which injuries require immediate intervention and which can be managed with observation. Another shocking aspect of air visits is medication-related emergency. Overdoses, drug interactions, incorrect dosing, and misuse of prescription or over-the-counter medications are common reasons people end up in the ER. In this video, the doctor reacts to such situations and explains how medications affect the body and why even common drugs can become dangerous if not used correctly. Emergency rooms are also deeply connected to mental health. Panic attacks, severe anxiety, emotional breakdowns, self-harm, and suicidal thoughts often lead people to seek emergency care. These visits can be shocking not because of physical injuries, but because of the intensity of emotional distress. The doctor reacts with empathy and explains why mental health emergencies are just as real and serious as physical ones. One of the hardest realities of emergency medicine is unpredictability. A patient who looks stable can suddenly deteriorate, while someone in critical condition can improve rapidly with the right treatment. In this video, the doctor explains how emergency teams constantly reassess patients, monitor vital signs, and prepare for sudden changes. This constant vigilance is what makes working in an ER mentally and physically demanding. The reactions in this video also highlight the emotional burden carried by healthcare workers. Doctors and nurses must stay calm under extreme pressure, deliver difficult news, and make rapid decisions that affect lives. They witness fear, pain, relief, and loss, sometimes all within the same shift. Through these reactions, viewers gain a deeper appreciation for the strength and dedication required to work in emergency medicine. Another important lesson in this video is learning when an ER visit is truly necessary. Many people avoid the ER out of fear or cost, while others go for conditions that are not emergency. The doctor explains how to recognize red flag symptoms that require immediate care and how understanding these signs can save lives and reduce unnecessary strain on emergency departments. Medical myths are another reason ER visits become shocking. People often believe false information about pain, infections, heart problems, or home remedies. In this video, the doctor reacts to cases influenced by misinformation and explains what science and medical evidence actually say. Correct information empowers people to make better decisions during emergencies. Teamwork is a critical part of emergency medicine. Doctors, nurses, paramedics, technicians, and support staff must work together seamlessly. The doctor explains how communication and coordination can mean the difference between success and failure in emergency care. These reactions show that emergency medicine is not a solo effort, but a team-based system. For viewers, this video offers more than just shocking reactions. It provides education, awareness, and understanding. Watching a doctor explain their cases helps people recognize dangerous symptoms, understand medical urgency, and feel more confident about seeking help when needed. This video is not created to scare viewers, but to prepare them. Fear often comes from the unknown. When people understand how emergencies are handled and what symptoms matter most, they are less likely to panic and more likely to act appropriately. The doctor's calm reactions help turn shocking moments into learning experiences. Many viewers may recognize similar situations from their own lives or from loved ones. These moments can be emotional, but they also highlight the importance of health awareness. Every reaction in this video is designed to encourage responsibility, prevention, and timely action. Communication plays a major role in emergency care. The doctor reacts to cases where missing information, unclear symptoms, or delayed history made treatment more difficult. These examples show why being honest and detailed with medical professionals can lead to faster and safer care. As the video continues, patterns begin to appear. Ignored symptoms, delayed care, misinformation, and unhealthy habits repeatedly lead to emergencies. The doctor connects these patterns and explains how simple changes can reduce risk and improve outcomes. Emergency medicine is not only about dramatic rescues. It is about preparation, prevention, rapid assessment, and continuous monitoring. This video reflects all of these elements through thoughtful reactions and clear explanations. If you are interested in real medical stories, doctor reaction videos, or learning how the body responds under extreme conditions, this video offers valuable insight. It combines education with engagement, making complex medical topics easier to understand. Watching this video may change how you view your own health. You may become more aware of symptoms, more careful with medications, or more willing to seek medical advice early. That awareness can make a real difference. If you found this video helpful or informative, subscribing to the channel allows you to stay connected with more health education and doctor reaction content. Each video is created with the goal of helping viewers make smarter, safer health decisions. Liking the video, sharing it with others, and leaving a comment helps spread important information. Someone else may learn something that protects their health or even saves a life. Building a community around health awareness benefits everyone. Emergency rooms will always be intense places, but knowledge can reduce fear and improve outcomes. This video is one step toward understanding emergencies before they happen. Stay informed, stay aware, and take care of your health.